Please be assured that the content in this video has been thoroughly reviewed and verified by a qualified electrical power engineer, along with a dedicated team of expert researchers, to guarantee its accuracy and reliability for your safety education. When you first respond to an electrical incident at home or elsewhere, your absolute first priority must always be to ensure the safety of the entire scene, protecting yourself from any potential hazards before approaching the victim. Importantly, never attempt to touch the victim directly if they are still in contact with the electrical source, as this could lead to you becoming part of the electrical circuit and getting shocked yourself. To safely disconnect the power, you can turn off the main electrical switch in your home. Carefully unplug the appliance from the outlet if possible, or go to the fuse box and switch off the appropriate circuit breaker. However, if the power cannot be safely turned off immediately, use a long non-conductive object such as a dry wooden stick, a plastic pole, or a broom handle to carefully separate the victim from the electrical source. Always avoid using any metal objects or wet materials for separation, since these can easily conduct electricity and put you at serious risk of electrocution. In high-voltage situations like down power lines, it's critical to stay at least 20 feet away from the hazard zone and immediately call your local power company as well as the fire department for professional assistance. Once the scene is safe, the next crucial step is to call for professional help right away by dialing emergency services, such as 911 in the United States, or your local emergency number without delay. When speaking to the emergency dispatcher, provide clear and precise information about the electrical injury incident, including your exact location, the type of electrical injury, and the current condition of the victim. If another person is present at the scene, delegate the responsibility of making the emergency call to them, and specifically ask them to locate and retrieve an automated external defibrillator, or AED, if one is available nearby. After securing help, immediately check the victim's response by carefully assessing their level of consciousness and verifying if they are breathing normally. To do this, gently shake the victim's shoulder while asking loudly and clearly, "Are you okay?" and watch closely for any signs of movement, groaning, or verbal response. Next, check for normal breathing using the look, listen, and feel method. Look for the chest rising and falling. Listen closely for breath sounds near the mouth and nose, and feel for any air movement on your cheek. If the victim is unresponsive but still breathing adequately, carefully roll them into the recovery position on their side to maintain an open airway and prevent choking on fluids. But if the victim is unresponsive and not breathing, or only gasping abnormally, you must begin CPR right away to give them the best chance of survival. Effective CPR starts with chest compressions performed at a steady rate of 100 to 120 compressions per minute, pressing down about 2 inches deep in the center of the chest with proper hand placement. Maintain the CPR rhythm by delivering 2 rescue breaths after every set of 30 compressions, ensuring each breath causes the chest to rise visibly. Keep performing CPR continuously until emergency medical help arrives on scene. The victim begins to show signs of recovery, like normal breathing, or an AED becomes available for use. As soon as the AED arrives, power it on and follow its clear step-by-step audio and visual prompts precisely to apply the pads and deliver a shock if advised. While waiting for emergency services after initial resuscitation, also treat any visible burns and monitor the victim closely for signs of shock. For any burns from the shock, immediately cool the affected area under cool running water for a full 10 minutes to reduce damage and pain. Gently remove any tight clothing or jewelry around the burn site to prevent swelling issues, but do not pull anything off if it's stuck directly to the skin. After cooling, protect the burn by loosely covering it with a sterile bandage, clean cloth, or plastic wrap to avoid infection. To help manage potential shock, keep the victim lying flat on their back, cover them with a blanket for warmth, and slightly elevate their legs about 12 inches if no spinal injury is suspected. Throughout this time, continuously monitor the victim for worsening signs of shock like pale skin or rapid breathing, while offering calm reassurance to keep them comfortable. Remember that electric shock can cause hidden internal injuries to organs like the heart or kidneys that aren't visible on the outside, so stay vigilant. Even if the person seems completely fine after an electric shock, always insist on professional medical evaluation, as complications can arise later unexpectedly. For complex high-risk scenarios involving downed power lines or vehicles touching high-voltage cables, stay back and wait for trained professionals like firefighters and utility workers to handle it safely. Mastering these essential first aid steps for electric shock can potentially save a life in a critical moment. So stay safe, be prepared, and practice when possible. If you found this comprehensive guide on electric shock first aid helpful, please give this video a thumbs up, like, and subscribe to our channel for more vital safety and educational content.